So healthcare is one of those verticals where edge compute is changing the game in not one, but two ways. They're the knowledge workers, the doctors who are taking advantage of information to do the job. And then there are technicians who are taking advantage of compute, which is coming to the machines they're using to help the patients. It's very interesting, right, that in healthcare, we see both of these groups of workers actually benefiting from edge compute. The doctors, they're able to get more information more readily, more quickly at their fingertips. And the technicians who are able to understand what is going on with the patient in real time and take advantage of technology such as AI, which is now able to help them figure out if there are things that they need to be focused on for improving the outcomes for their patients.
When it comes to being able to facilitate connectivity for medical devices specifically, they have some somewhat unique challenges, both from the perspective of needing connectivity and being, I'll say, somewhat notoriously inflexible as far as the ways that they can connect to other things, but also from a security standpoint, being able to profile and treat these devices as they should be, because obviously for medical devices specifically, it's a highly regulated industry, a lot of requirements around privacy and security in that space. Somewhat similarly, when we get into the actual end users, whether that be a practitioner in a clinic that needs to have reliable connectivity, do things like push prescriptions, pull patient information, access their EMR, that obviously is very important, even out to the extent of the professionals that might be working from home or working remotely. So when we talk about things like being able to aggregate connectivity and ensure that downloads can be sped up, for example, on somebody's home internet connection, that can be incredibly important for somebody like a radiologist that's pulling large image files back and forth all day long, and their time is valuable. So it's something where, the more time that they're going to spend just waiting for something to get downloaded or uploaded so that they can look at it and do their job, then, that obviously has an external cost that they're going to incur just by waiting for that amount of time.
We have to provide a fast, reliable, and secure connectivity so that users on whatever platform they are on, whether it's their mobile phones or the PCs, are able to connect to our infrastructure so that doctors can appropriately diagnose these patients. We've also seen cases where radiologists are spread across the country and they need to be able to access the X-rays, the MRIs from patients, and they need to have that in a high-resolution format sent across these WAN links. VeloCloud ensures that these radiologists have access to that data and are being able to appropriately diagnose the condition of a patient. In the context of HIPAA, we have to ensure patient data is not compromised. It is secure, and especially when physicians are trying to access these records are sent over a network that provides that level of security. VeloCloud SD-WAN does just that. It has a lot of encryption methods, a high-grade encryption method such as AES 256 that ensures end-to-end connectivity is secured. The platform itself, the transport itself, doesn't store the records. So now we have to look at a solution that provides that secure storage of these records. And this is where the edge compute stack as part of software-defined edge ensures that our applications are run in an environment at the edge that provides that level of security. So if you combine the ECS stack with the VeloCloud SD-WAN, and together we bring in that level of security and compliance.
Yeah, in healthcare, AI can actually help save life. So especially with Edge AI, you take a look at a lot of medical imaging that are coming out, right? These are pretty big, and Edge AI can help diagnose the problem, speed up the analysis, pinpoint the problem so that the specialist can pay closer attention to. The other thing it's actually very good at is taking data from multiple places, patient vital sign, visual data, medical history, and then basically alert the care team of something bad about to happen before it becomes an emergency situation. Save life.
So in the healthcare industry, there are two use cases that I would like to highlight where edge compute plays a significant role. One is in the case of hospitals. Today, majority of the time, what happens is after you take an X-ray, it takes about an hour or sometimes even longer than an hour for the doctor to get a copy of the medical image. So where some of our healthcare customers are looking at deploying an edge compute stack in the hospital itself is for processing these medical images in a more rapid fashion so that the doctors can have immediate access to these records, to these information, so that they can deliver appropriate treatment to their patients instantaneously. The second scenario where I would like to highlight is in the case of medical ambulances. Now, these medical ambulances today, when they go and pick up a patient who is undergoing an emergency, it typically would like to stay connected back to the hospital so that they can feed the health status of the patient back to the hospital so that they can prepare whatever setup that they have to prepare to take in this patient immediately and provide the first aid that is necessary. Since this ambulance is going to be going in the roads with poor connectivity or going through congested networks, now there is a possibility for that data to not be transmitted in a continuous fashion. By combining SD-WAN and combining edge compute together and deploying that as a integrated edge in each of these ambulances, now it provides the ambulance services companies to provide continuous connectivity with a significant bandwidth so that they can keep the hospital updated about the patient's status as they are going through the traffic in the city streets.
I can think of a customer in particular. They were spending a lot of money on bandwidth. Over the years, they had thrown a lot of bandwidth at problems to try to fix them. So it really became kind of a bloated section of their budget. And one of the things that we were able to do with the VeloCloud is get some good metrics out of the data out of the VeloClouds for us to understand what they were actually using in terms of bandwidth at these locations. Sometimes they would go out and purchase a 2 gig circuit at a location, and we would come back with the data from the VeloCloud and say, look, you guys are only using 100 megs here, right? We don't need to spend all this money. And the cool part about that is we actually were able to take some of the money that was being spent with their ISPs that they no longer had to spend, and we actually reinvested that in the SASE offering, and we were able to bring in the SASE offering from VeloCloud as well, which actually helped them out because they were in a situation where they were doing about 17 different proof of concepts with different vendors for a bunch of different security aspects in their network. And we were able to bring in the SASE product powered by Symantec and actually able to solve that with just one product. One of the other challenges with some of the healthcare facilities, right, is maintaining a level of uptime, right? So a lot of these are mission critical sites where they're doing very important work for people's health. So they wanted to make sure that those sites never went down. And bringing in the VeloCloud solution, we're able to bring in multiple ISPs, even sometimes tertiary connections, to ensure that those sites do not go down, and they can always maintain that level of care for their customers.
If we think about devices in a hospital, whether they're cameras, whether they're EKGs that are connected, there's a huge opportunity in virtualization to ensure the stability and uptime of these devices. But having the right partner that can deliver that is equally critical. And that's why we think that together, between us and the various healthcare providers that we count as customers, we are actually making a difference in the well-being of society.